name is Jamie Corsa. Today I'll be demonstrating how to administer insulin and as well as injecting them subcutaneously. So first, I am outside the client's room. I am in the medication room, and I will perform hand hygiene. Now what I want to do first is I have my healthcare provider orders as well as my MAR. So I just want to make sure that I'm comparing those, making sure everything's correct. So first I'll start with the patient's name, Shirley Coast, 54. Date of birth, 5/14/64, 5/14/64, Dr. Leo, room 211, room 211. So then I'll start down to the insulins. So NPH insulin, 15 units subcut daily with supper. NPH insulin, 15 units subcut daily with supper. Regular insulin, 10 units subcut. Regular insulin, 10 units subcut twice a day. This as well says twice a day. Then you'll do the Lispro insulin pen, and that will be on a mild sliding scale. And a Lispro insulin pen, mild sliding scale, subcut 3 times a day with meals. 3 times a day with meals. Okay, so right now it is 17:15. I'm preparing to administer the medications scheduled for 17:30. The CNA did report that the client's blood sugar was 276 at 17:10. So I'll look down at my sliding scale and I'll look and see that I'm giving 6 units. So now I will make sure I have everything I need for it. So starting with the NPH insulin, which we'll be doing 15 units subcut daily with supper. Then we have our regular insulin, 10 units subcut twice a day. And then we have our Lispro insulin pen, which again will be giving 6 units. I then have my needle for that. My alcohol preps, and my label. Okay, so then I will don gloves. Okay. So before I administer the mixture of NPH and regular, I do want to make sure that you are able to mix them. They are mixable. Okay. And then you'll notice that regular is a clear and NPH is kind of that cloudy. That is normal. We do want to make sure that we kind of mix it up though. You don't want to shake it, so we'll just rub it in between the palms here. Okay. So then I want to take an alcohol prep. And I want to wipe the tops of the vials for about 10 to 15 seconds, making sure they're nice and clean. Okay. Again with the other one. Okay. So now since I'm going to do the regular to cloudy, the regular and NPH, I always want to go from clear to cloudy. So what I want to do first is I want to make sure that I am putting air into the NPH. So it wants 15 units, so we'll do 15 units of air here. And we will insert it into the NPH. And then we'll do our 10 units of air and insert it into the regular. Then I will flip it and I will draw out 10 units of the regular. Okay. There we go. Again, because I checked to make sure that we're doing the right dosage, what the dosage is in the vial and the expiration date, I want to make sure with another nurse that it's the right name. They're verifying with me as well. It's the right dose, and then they would sign off on my MAR. Okay. Then I'm going to go straight to the NPH. I do not want to put any regular into the NPH vial, so you'll just go from there. Again, pulling just down to 25 because that adds your 15 units. Again, verifying with another nurse, dosage, expiration date, patient, all that stuff. Then we will have her again sign off on the MAR. And then I will scoop the cap back up. And then I will write a label here. And do the label around. And drop it on the tray. Okay. Now I will move on to my insulin pen. Again, we verified her blood sugar was 276, so we are giving 6 units. And what I want to do first is I want to take this off and do an alcohol prep. Make sure I'm wiping it. All around here. Before putting the needle on. So take this off. Then I will put the needle on and you kind of just screw on till it's on there good enough. Okay. So first, before I do my 6 units, what I want to do is I want to push it to 2. And then I just want to kind of push it and just make sure that it's primed. And there's a little liquid on there, the tip there. Okay, now I will move to 6 units. And then I want to verify that this is Lispro, 6 units with another nurse. And then she will sign off on my MAR after she verifies that. Then I will put the safety cap back on and onto the tray. Okay, so now that I'm done with that, I have noticed that my patient has just received supper, so we will go in there and we will administer injections. So I walked into my patient's room. Alrighty, and then now we'll do this. Hello Shirley, how are you today? Oh, good, okay. So I have a couple of insulin injections for you. We had the CNA take your blood sugar earlier and it was at 276. Okay, so I am just going to verify with the patient. Shirley, can you verify your name and date of birth for me? Shirley Coase, 5/14/64, perfect. And Shirley, I just want to verify on your wrist here everything. And then your allergy as well, which is codeine. Okay, so just verifying it with the MAR. Okay, Shirley, so I see that you have your supper, that's good. So we are going to administer a couple injections for you. Yeah, you're probably used to that. And then we just want to make sure that you're eating right after because they are fast acting. So Shirley, is there any certain place that you usually administer your insulin injections? Usually on your abdomen? Okay, well I'll just keep it on your abdomen and making sure that we just keep it there so it's kind of in your routine. Perfect. Okay, so Shirley, first we are going to do your NPH and regular mixed insulin. Oh, you do that at home? Okay, so you're used to this. You know what we're doing then. Perfect. Okay, so I'm just gonna lift this up, making sure that you're only seeing the patient's belly button, respecting their privacy. Perfect. So I just want to take an alcohol prep here. It's going to be a little cold. I'm going to start rubbing it down. There we go. Okay. Okay, Shirley. So we have your mixed insulin. We have the 10 units of regular and the 15 units of NPH. So we'll go ahead and administer that. So what I'm going to do is you're just going to feel a slight little pinch here. And on the count of 3, 1, 2, 3. and slowly just inject it. Perfect. Okay. We'll put the safety on that and go straight to the sharps. Okay, Shirley. Now what I'm going to do is I'm just going to move over to the other side. For the other injection, we are going to wipe again. Good, okay. So now this is Lispro insulin, and like I said before, the CNA did, they did verify your blood sugar and it was 276, so we are going to give you 6 units. Again, 6 units. Just want to make sure it did stay there. And this is the Lispro, so you're going to feel a squeeze. You kind of want to hold this like a dart, and then you just want to push down till you hear a click, and then hold the button down for about 10 seconds, 8 to 10 seconds. Okay, there's that. You don't want to rub the injection site or anything. Okay, so I'll take this and I will unscrew the needle here, putting this and right to the sharps. Put the cap back on here. Okay, Shirley, so those are your insulin injections. You do have your supper here, so I do want to make sure that you are eating. Like I said, this is kind of quick reacting. I will be back to check on you in about 15, 30, 20 minutes, I would say, just to, monitor and make sure that the patient doesn't have any symptoms of hypoglycemia, and also making sure that she ate her dinner. Okay, Shirley, so do you need to use the restroom or anything before I go? Okay, you're really hungry? Oh, good. Yeah, make sure you definitely eat. We want to see you eating. Make sure you have the call light right here, and I will be back in 15 minutes. Okay, so I would leave the patient's room. I would then document, again, perform hand hygiene, and return in 15 to 20 minutes.